Now, I'd like to pass it over to Maria del Carmen Parra Cano, who will provide our opening blessing. Maria is the founder of the Siwapatli Collective, which is an organization aiming to provide healing for urban Indigenous peoples through sharing wisdom, connecting resources, revitalizing traditional knowledge, promoting and advocating for health and wellness. Maria, it is great to see you, and I'd like to recognize and thank you for being a part of the summit. Welcome. Bienvenida, Maria.
Thank you, Laura. Good morning, Cualitlanesi, buenos dias to everyone here this morning. Thank you for that beautiful land acknowledgement that is so important for many of us and the work that we do to connect with not only the land and the space that's around us. So this morning, I'd like to invite everyone to prepare your space, whatever you have in front of you. If you have a candle, a cup of water, your medicines that you have, if you're able to connect with this morning as we have our opening blessing here. I will first start off in my language and then traditional language, and then translate as best as I could for our other relatives here in this space. Imashpancinco Nawayolke no toca María, Chaneque Parracano, Tazokamatiwe no Nansin no Tansin, Tazokamatiwe Tonansitlali, Tazokamatiwe Atom Jevid Piposh, Tonansintlali Abiayala, Tiwatinsuyo, Tazokamatiwe A Ejeca Tet Tlali, Tazokamatiwe no Cocotzin, no yaut, This morning, I'd just like to say thank you to our lineages, our ancestry, to those that have prepared these pathways for us to do this work, as well as our lineages, each of our respective communities, those that have instilled the will to move forward, to advocate for families, to advocate for birthing relatives and children. I ask Creator to bless us this day and continue to guide our work, acknowledging the elements of life, the lands, the spirits, and also, again, these traditional homelands here in the Phoenix area. Also like to before proceeding, acknowledge all the other relatives we have here in the state. These, we're 21 federally recognized, but at Phoenix as an urban Indigenous city, we have thousands of families that cross our paths on a daily basis. So with that being said, just thank you again. We pray that everybody's work and day is felt with an open heart and open mind, and that we can all journey together to continue this work in our efforts to strive for healing our communities. Ometeo Tasokamati. Thank you.
Gracias. Thank you so much, Maria, for that beautiful opening. We appreciate you joining us and for the role that you and the Siwapatli Collective play in addressing maternal and infant health in Arizona. Thank you. So this year's summit was built around circumstances that we know to be growing concerns for maternal and infant health, the impacts of mental health and substance use on maternal and infant mortality. Our theme, See Me Differently, was coined after ADHS's recently released campaign aiming to reduce the stigma of maternal mental health and substance use disorders, in hopes that healthcare providers can establish places of care where women experiencing these conditions are not afraid to go and seek safe and effective care that they need and deserve. Our objectives for the next 2 days include describing the impacts of mental health and substance use on maternal and infant health outcomes, discussing community, hospital, and post-hospital-based approaches to support women and families impacted by trauma, and sharing innovations in community-based social and cultural supports for families. Here is a brief glance at our agenda for today and tomorrow. Today, we are so excited to kick off the summit by hearing directly from Arizona families about how maternal mental health and substance use has impacted their trajectory and the critical role that non-judgmental supportive staff were in overcoming these challenges to become thriving parents. For the rest of the day, we will be focusing on the impacts of mental health on maternal and infant outcomes, including learning about current trends in maternal mental health and substance use in Arizona, learning more about the intersection of perinatal mental health and substance use, providing trauma-informed care for families experiencing maternal mental health and substance use before, during, and after pregnancy. And to close out the day, we will hear directly from community-based organizations about how they provide social and cultural support to pregnant and parenting families. Tomorrow, we'll be more focused on the impacts of substance use on the maternal and infant health outcomes, including a host of speakers that will be addressing the impacts on fetal and infant health, how to support women and families with substance use disorder during and after pregnancy, providing culturally relevant behavioral health care, and learning about how to improve access to behavioral health care in Arizona. Before we get started, I wanted to take a couple of minutes to share some exciting progress and new developments related to maternal mental health and substance use that we are seeing at the Arizona Department of Health Services and among our partner organizations and agencies. First, we always aim to center our work related to maternal health around our Maternal Mortality Action Plan, which aims to reduce the overall maternal mortality ratio in Arizona by 10% in 5 years. ADHS and our partners are trying to do this through building awareness among providers, women, and families, improving access to care, bolstering workforce capacity, improving availability of data, and supporting the systems of care for maternal health in Arizona. I'll share some specific examples of how we are doing this in a moment. We are so excited to announce our upcoming release of the Arizona Fetal Infant Mortality Action Plan. This plan is currently being finalized, but is centered around 6 key goals, all of which we aimed to align with the Maternal Mortality Action Plan. The Fetal Infant Mortality Action Plan, or FEMAP, aims to achieve the following goals: reduce prematurity and preterm births, prevent birth defects, strengthen systems of care for mothers and infants, diversify and strengthen the workforce, improve surveillance of fetal infant morbidities and deaths, and promote optimal fetal infant health. Please watch for an announcement with a formal release of this plan and the actions associated with each goal later this year. The other action plan that I wanted to share is the Arizona Neonatal Abstinence Syndrome Action Plan that was released in 2018. This plan is aimed to establish a coordinated approach to increase awareness and improve outcomes for families impacted by opioid use and substance use during pregnancy. ADHS has been actively working on this plan with our partner agencies and community organizations to implement this plan since its release. We anticipate releasing an updated surveillance report this fall. One example of those efforts is a recent campaign that ADHS launched aimed at reducing the stigma associated with substance use during pregnancy. The image on the left from our campaign called See Me Differently, which is aimed at changing negative perceptions of maternal substance use among providers and help them provide kind and compassionate care and treatment. The image on the right is from our campaign called Hope Heals, aiming to support and encourage women with substance use disorders to seek help before, during, and after pregnancy. As another example of how we are aiming to achieve the Maternal Mortality Action Plan was in fall 2021, ADHS partnered with the Postpartum Support International to train providers. In that time, 430 providers were trained in perinatal mood and anxiety disorders, 221 providers participated in the advanced psychotherapy training, and 60 providers participated in the advanced psychopharmacology training. We are proud to say that all of these providers came from 14 of Arizona's 15 counties, and it is a great example of how we are aiming to build provider capacity to improve access to maternal mental health care in our state. Another exciting partnership has been with Count the Kicks. This summer, ADHS sponsored a live webinar to launch the Count the Kicks campaign in Arizona to get the word out on this evidence-based stillbirth prevention campaign. Providers, home visitors, and community agencies learned about the evidence behind Count the Kicks and about free resources and tools to share with expectant parents. You can scan the QR code on this slide or visit the Count the Kicks website to order your free resources. Arizona resources are available in English, Spanish, Swahili, and Dene. By sharing the Count the Kicks materials with expectant parents, you are helping to bring awareness and reduce the number of stillbirths in Arizona. ADHS is thrilled to be working with the Count the Kicks team, including Arizona's parent ambassador and Western Region co-lead, Sean Sumilas, on this important topic. Now I'm going to share a couple of exciting updates from our partners at Access. In January of this year, Access convened the legislatively mandated Maternal Mental Health Advisory Committee, which is charged with recommending improvements for screening and treating maternal mental health. Their recommendations are due to the state legislature in December of this year. The advisory committee has worked closely with and adopted the priorities of the Maternal Mental Health Task Force to focus their recommendation and increase collaboration. Through this partnership, Access has moved forward to create a statewide perinatal psychiatric access line. They are partnering with the University of Arizona to launch the program, which is intended to further increase access to maternal mental health care in Arizona by building the capacity of our frontline providers. This line will serve as a resource where providers can call to receive consultation and education about caring for their patients, as well as improve care coordination across the state. Once this line launches, we will make sure to make a broad announcement. Access has also been working on some updates to the early and periodic screening, diagnostic, and treatment rules to include postpartum depression screening in pediatric settings, which would further improve detection of maternal mental health conditions and our ability to link mothers to care. Finally, many of you may have seen this, but HRSA launched a national maternal mental health hotline this year, which provides 24/7 free confidential support before, during, and after pregnancy in both English and Spanish, and with interpretation services for over 60 languages. This is such an important resource across the country, and we hope that you share it with your networks. What I shared is just a snapshot of the work we are doing to improve maternal and infant health outcomes. If you'd like to learn more, I invite you to visit the Bureau of Women's and Children's website for the most current information on ADHS programs, reports, and updated data that might be helpful for you. The Summit website on HUVA also has a ton of resources available on the documents section of the site. There are also session-specific resources available if you click on a specific session on the agenda. Importantly, I'd like to point out our email address, maternalhealth@azdhs.gov, where you can send any questions related to our maternal and infant health programming. And lastly, I want to thank our ADHS staff, community partners, state agencies for their ongoing partnership in this work. ADHS is only one of the many system partners working to address maternal mental health and infant health in Arizona. It is through our collaboration that we move our work forward. Thank you. Now I'm going to turn it back over to Jeanette Shea, champion for maternal and child health in our state and our moderator for the Maternal and Infant Mortality Summit. Thank you, Jeanette.